Once again, I'm excited to be here on Research Podcast. My name is Isaac Darlington, and today we have gone into the field. Like you can see, we have properly suited gentlemen here. We've gone into the field of science and particularly health. I do have with me Dr. Charles and Dr. Ivan from the Icon Dental Services. We are privileged to have done some work with them under Haven Inventives. We have some, actually we do have some projects running with them. We did an audiovisual ad with them, and I believe a couple of you have seen it. I think the work was good.
Yeah, it was really excellent, brief and well detailed.
That is what we call professional. We don't play in things. You know, for us in media, I believe this, it's the same thing with even in the medical field. Time is money.
Definitely.
Time is key.
Okay, it's a universal law.
It's a universal law.
Yeah.
And it goes even deeper in your field that time and health are really tied together. I went to Icon Dental Services to get my tooth done. It had a very bad decay.
That's right.
Yes, it had lasted, I think I spent over a year. You know these things of being a man. It's okuguma ngo musajja.
You man up.
Hey. So I and also money. I will not lie. And I didn't want to remove the tooth. And then, you know, that procedure we went through, I was a bit afraid about the costs and all of that. So let's get down into Icon Dental Services and what that is about. I will start off with Charles and then Ivan, and we'll just briefly talk about Icon Dental Services and then we get into other things. Yes.
Oh, yes. So this is Dentist Charles, practicing dentist. Yeah, I'm from Icon Dental Services, Mbale, on that former Mbale Shoppers building. Of course, it's near Has petrol station, and we're on the first floor. Yes, we are ready and are fully stocked for any dental services required. Yes, and it's actually a clinic and a lab.
Okay.
We treat teeth and make teeth. So it's a full stock center for any dental issue. Yes.
Yes, Dentist Ivan. You're welcome on board, sir.
So I am Wamboko Ivan. I'm a dental technologist working at Icon Dental Services in Mbale. As my colleague has told you earlier on, we are ready to serve the people of Eastern region, particularly the ones around Mbale city. Previously, we had a deficit of dental services, like the dental laboratory services, vis-a-vis making artificial teeth, braces, aligning teeth.
Yes, yes.
Okay. We could get patients from Eastern coming to Kampala to receive those services. And that's where we got that curiosity to set up a very nice place in Mbale. And we are ready to serve you.
Okay.
You're welcome.
Now, the dental technologist,
Yes.
what does that person do? Because that one is a bit new.
Yeah, yeah.
Definitely.
It's a
So, briefly, a dental technologist does what we call auxiliary work, aiding a dentist or a dental surgeon in delivering dental treatment. They do artificial teeth replacements for those who lost teeth. In Luganda, they call them mapengo. Obaka mapengo in Lugisu, in Lumasaba. So we replace those gaps so that your smile can be restored. We also make appliances that help align teeth into position. Those appliances can be used in conjunction with braces or independently.
okay.
Then we make also night guards for those ones who grind teeth, clench teeth at night or during day.
What is it called? How is it say? You say in Lumasaba, those who
Who grind teeth?
Yes. There's a word for it.
They call it Babanyanya Kamen, I think something like that.
And usually it is believed that those people have what? Evil spirits.
Have evil spirits, yes. It's not true. They are not evil spirits. It's a medical issue, a dental issue that needs intervention, needs treatment. And we also have that treatment at Icon Dental Mbale.
Okay.
Yes.
Very interesting. I went through a procedure with dental Charles, and like I said before, my fear was financial. I want us to debunk some of these things that many of us fear going to the dentists because of the figures, the amount of money. How best would you guide someone who says, this is the kind of money I have, and you know, comparing it, of course, with the service.
Well, as we all know, any service, or medical, any other thing, service, is a little financial bit of it. Yes, but I couldn't love to see money hindering anyone from getting a service. Yes. So with the issues of money, all these things are, dentistry, the good thing with dentistry, most of the procedures are not a single visit thing. So we embrace installment payments, and of course we are humans. It's that room of discussing on how a person will be able to clear up with the Jews.
Yeah.
Yes.
Okay. Very, very, very good there. Both of you really advised me against removing my tooth. I'm speaking now from personal experience because I don't want to bring people happy and I have not gone through their experience. It may be unfair. You explained to me that once you start removing a tooth, it creates a chain,
Yes.
a sort of reaction,
A
pattern, because these teeth are connected to each other. One way in which I think you can try and make sure it's called
The dentition, teeth.
Yes. Dentition.
Dentition.
Okay. The teeth are safe is by doing regular visits.
True.
Dr. Ivan,
Yes, please.
how often should someone do some of those visits?
Those visits are supposed to be at least, we always say at least because patients sometimes cannot have that time to visit a dentist regularly.
Yes.
But they can do that at least 3 times a year, or even more if someone accesses a dentist or has time. They can even do those visits more than 3 times. That is so significant because for most patients, before they step to your clinic, they might not know that they have an issue with their tooth.
Yeah,
not until it becomes tender or it develops pain is when they realize, oh, I think my tooth is not okay. Let me go to a clinic or call a dentist, blah, blah. Before that, even when a tooth is progressively going to that stage of pain, they will not notice it. And yet, we can help them curb a decay on a tooth or fill the cavity before it gets worse. And that also calls for a lesser cost, okay? Than feeling the pain, then you come for root canal. Root canal will call for a little bit, much more amount of money compared to a filling, which you would do at first, okay? Yeah, so simply 3 to 2 times a year is fair.
Okay. Now, we have a place in Uganda, in eastern Uganda to be particular, that is serving our dentals. My experience is that I did not know that we had a place where we actually make teeth. I experienced it here myself when I saw teeth being made. and they look like real teeth. That's the other very interesting bit. And it was done really nicely. It was done really professionally. What inspired? This question will actually play to the both of you. What inspired you to chase the dream of dentistry, being dental people who health experts in the area of teeth? I'll start with Dr. Ivan. What pushed you down this road? You went through different educations, and for you said, this is it.
Well, usually, I will start from my historical perspective. While I was still in high school, I would often get issues with the teeth, toothache, or often year after year, month after month. So I decided to visit a dentist in a local health center. I had my first tooth extracted. And the second time I went to him, he was so touched to an extent that he told me, you're a young boy and you are coming here often to extract your teeth. Aren't you going to lose all of them before you grow up? So he raised an issue, and after extracting that one, he told me to keep my oral hygiene good, brush my teeth regularly, so that I don't get back to him again.
Yes.
Because he's tired of seeing me to the
extract,
facility
yes.
extract, yet despite of my age. Okay.
Yeah.
So he also told me, I can see you a student, because I would go with a school uniform. I can see you a student. How I wish you would study and become a dental personnel like me. And probably you
would save other people.
Exactly, and your own teeth as well. Okay, so that's where I got the confidence and the urge from. He really inspired me a lot, because he would step to the facility within 15 minutes or 20 after extracting just a few people. He steps out. I don't know whether he could go to town or to his own private facility, but others he would tell them, come back the next site. I saw dentists as very special people, a very special field. And of course, we kept on pushing with education. Yeah. And my dream came true. I found myself in the dental sector. Yes.
Charles.
Well, actually, for me to be honest, since my childhood, I never dreamt of being a dentist. Yes, it's something that came along the way. So I remember when I was still a young boy, my dream was always to be a lawyer. Hey, that was my dream.
Yes.
But I was, I think, in senior 3. Senior 3 years. There are some students who came from Makere. They are doing dentistry. And they came for an outreach in our school. Yes, back then in Masaka. And then they came, they did check up on us. They gave us some guidance on how to keep teeth. And they did a few procedures, and they were really nice. Yes, they gave us the good things about dentistry. And from there, I picked up the momentum to go more in dentistry. Actually, I didn't go straight in dentistry, but I loved mostly things which relate to teeth, because actually by then our curriculum, we had that part of digestive system. So there's that part of the mouth chewing. Then I studied things of teeth, off topic things which I even didn't have.
Yes.
Because I actually had that fire since that time. But when I started from senior 3, went to senior 4, your old dream normally takes over. So again, I forgot things of the industry. Then I continued.
With wanting to be a lawyer.
A lawyer. Yes, I did my senior 4. And then results came back. Yes, I had passed science as well. and I was at war with my dad.
Over which route to take.
Which wouldn't
person.
yes, but I composed myself,
Yeah.
and I thought it wise, because actually the dose then for him was like, surely let the child do what he wants. Don't force him. Let him do what he wants. But he said that you can still be a lawyer if you do sciences. Nothing can hinder you. Then I entered my
Haven't you hit the lawyers that someone can still do their job even without having maybe going through their system?
Yeah, actually.
Okubye nnyo.
No,
because a lawyer cannot do a doctor's job. It's
Yeah,
not here, but
definitely.
yes. So surely I did my A level, did that mind that after these things are going for law. But eventually, still, I don't know how this thing came up. They again came up with an outreach, but it wasn't in school, it was in our locality. Actually, that was the VAC, senior 6. They made some outreach in our locality. And when they came, still, the vibe kept up. And that's when I decided, no, let me go for this dentistry. That's why I got the energy to say, let me go dentistry. I think it's better because they gave us that new understanding that surely dentistry is kind of, they use the word virgin.
it is a virgin
It's a virgin field.
There's not so many people who
Yes. And then that's how I started dentistry. And my higher.
Yeah. Now, we have one of the best. It is one of the best state of the art at Icon Dental. There's a bunch of machines, like you can see for yourself. We have machines that I don't know their names, by the way. Yeah, but we have that in Eastern Uganda, which shows that as a region, as Mbale, Mbale is constantly developing with the health centers, and you said something about it being a virgin field. There is a lot of opportunity for you who is watching and you're into sciences. You've been wanting, people just look at the field of being a doctor as general.
Yeah.
Most times, I want to be a doctor. They're talking about the one who's working in main hospital doing ward rounds. But they're different fields.
Yeah, true.
And this is one of those fields.
Yes.
My question now is, most people have issues with the teeth, yes, but they don't have access to the information.
True.
They only have myths that the tooth is paining, chupanado. You chupanado, it will help to and what can be done to get this news and this information out there? You said something about outreaches. Is Icon Dental going to do some outreaches? How are you going to try and make sure that people get to know some of these services that are offered?
Actually, with Icon, it is actually we have designed outreach as our backbone. Yes, we are going to surely emphasize more on outreaches. Actually, on our agenda, God willing, we hope to host our first outreach. I think next year. Next year, yes, around March, we plan a mega outreach basically on this Bugisu sub-region. Yes, for it's the only way we can surely tell people about these things.
And on that outreach, you shall have also artificial teeth being made. We shall have people smile again. Those ones will be malibu. So you prepare. March next year, we are there to give you the best service.
Okay. There are people who sometimes, you got an accident, or you got into a fight, you lost your teeth, you've been feeling uncomfortable, you can't smile for your husband. Well, as a man, you're feeling you don't have that, that confidence anymore. You cannot approach. There's a fiance you want to propose to. Hey, you have, you're worried about your dentals. Just first approach Icon Dental, get to see some of the services. Many of the things that most of us are worried about can actually be worked on.
Have free dental checkups. They started in March this year. Up to the offer is moving up to May this year. They are free checkups. You come, sit, we check, we tell you the problem, no charge at all. Yes.
Ndoza kumukategedde Icon Dental Services. Their numbers are running at the bottom of the screen even now. Feel free to reach out to them. Location again, former Mbale Shoppers.
Shoppers.
First floor. When someone says first floor, it's not the one that is down. That is the floor. That is the ground floor.
Yeah.
The first floor is the one you get to after climbing. That the first stair climb, right there. You move to your right. Far end, you move to the far end, maintain your right, you'll see it. You cannot miss it.